Hello everybody, we are Group AA. Our group members include Jackie Joyce, Bree Bolden, and Mike Atkinson. And the question we are answering today is what exercise regime is best for your heart?
We're going to start off by describing what heart disease is. Coronary artery disease occurs when plaque, made of cholesterol, clogs up arteries. As plaque builds up, blood flow decreases. If too much plaque builds up, a blockage can occur, causing a heart attack. Here you can see a picture of an artery that has some plaque buildup.
Some common risk factors for heart disease are family history, obesity, lack of exercise, high blood pressure, poor diet, and excessive drug use, including smoking and drinking. Your risk can change though. Studies show that people who quit smoking decrease their chances of heart disease. Better diet, lowered blood pressure, and weight loss can also decrease your chances of heart disease, even if you had a risk factor in the past. The only risk factor that cannot be changed is family history.
Originally, patients with coronary heart disease were told to exercise, but only at moderate intensities. New research has found, however, that high-intensity exercise can be beneficial to these patients.
All participants of this study had heart disease. High-intensity exercise involved the 4x4 model, where 4 minutes of high-intensity exercise are alternated with 3 minutes of moderate-intensity exercise. Heart rate during intensive exercise should be 85 to 95% of maximum. There were 4 groups of participants. Each group used a different type of exercise, such as running on a treadmill or hiking outdoors. The intensity of the exercise was measured by the VO2 max, which is maximum oxygen uptake. The tested exercise period was 12 weeks.
Results of the study. After about 23 training sessions, patients that went through the exercise program showed significant increase in peak oxygen consumption. This implies that their cardiac health was improved by the exercise program. Patients with higher heart rates during the exercise program benefited more from the exercises. In May 2011, the Harvard Heart Letter published the results of a study done by the Pennington Center for Biomedical Research located in Baton Rouge, Louisiana. In this study, all patients were affected by diabetes. The patients were divided into 4 groups: one control non-exercise group, an aerobic exercise-only group, a strength training group, and a group that combined aspects of aerobic exercise and strength training. The researchers over the course of the trial measured hemoglobin A1C levels in the blood. Hemoglobin A1C is a measure of blood sugar. Hemoglobin A1C levels fell significantly less in volunteers who participated in aerobic exercise or strength training only. Muscle tissue sponges sugar from the bloodstream. By building muscle and keeping it active, blood sugar levels can be kept in check. The improvement in blood sugar levels is also heart healthy, says Dr. Timothy S. Church, the lead author of this study. The improvements seen in participants that did both aerobic and strength training could also be expected to lower the risk of having a heart attack by 15 to 20%.
The following study on exercise-induced right ventricular dysfunction was published in the European Heart Journal. In this study, researchers looked at 4 groups of endurance athletes. Each group participated in a different event. The 4 events were a marathon, endurance triathlon, alpine cycling, and an ultra triathlon. Using magnetic resonance imaging, also known as MRI, the researchers measured heart performance before, directly after, and a week after the event. This study shows that too much exercise can be bad for your heart. The endurance events studied vary in length from 3 to 11 hours. The participants showed temporarily reduced right ventricular function after the events. Some athletes showed permanently reduced right ventricle function, a condition known as myocardial fibrosis. The left ventricle showed no negative effects.
Myocardial fibrosis is a condition that replaces normal healthy heart tissue with tissue that was unable to contract. Here you can see the difference between a healthy heart, a heart with mild fibrosis, and a heart with severe fibrosis.
These graphs depict the temporary decrease in right ventricular function after each endurance event. The baseline measurements were taken 2 to 3 weeks before the event. The post-race measurements were taken within an hour after the race. The delayed measurements were taken 6 to 11 days after the event. The post-race measurements show a decrease in right ventricular function after each event. The delayed measurements show a recovery in right ventricle function over time. This shows at least partial recovery in right ventricle function.
We had mentioned before how to exercise if you have a chronic health problem. But what do you do to maintain your heart health if you are considered healthy? For the average healthy adult, Surgeon General Regina Benjamin recommends 30 minutes of moderate activity per day. This can include walking, jogging, swimming, dancing, or group class at the gym. 30 minutes of activity per day seems like a lot, but it can be broken up. A 15-minute walk on your lunch break plus playing with your kids when you get home counts as 30 minutes of moderate exercise. There are many benefits to regular exercise. One of these is the improvement in the body's ability to transport oxygen in the bloodstream. This means that there is less fatigue when performing daily tasks. Another benefit of regular exercise is the body's ability to dilate blood vessels in response to physical activity. This also helps transport oxygen to the body as well as keeping blood pressures from rising to dangerous levels. Since exercising now could be a combined total of 30 minutes per day, more patients with cardiovascular diseases are able to participate. Those who do participate in moderate exercise see a decrease in death rates, around 20 to 25%.
This graph shows the difference in death risk between groups with different levels of fitness. It demonstrates that even moderate levels of exercise can dramatically reduce risk of death.
In conclusion, exercise, even in modest amounts, can help reduce your risk of death. Doing at least a combined amount of 30 minutes a day is the recommended minimum by the Surgeon General. The type and amount of exercise you should do varies. It all depends on your personal health and cardiovascular risk factors. The one type of exercise recommended by every study mentioned previously is some form of aerobic exercise.
Americans nowadays are super busy, but aerobic exercises don't take as long as you might think. The 4x4 model mentioned earlier for cardiovascular patients is also relevant for healthy adults. This program involves 4 minutes of intense exercise followed by 3 minutes of moderate exercise, repeated 4 times. The model can be used for many types of aerobic activity, including running or hiking. Aerobic exercise works to increase peak oxygen intake and improve blood vessels' ability to dilate. This ensures that the other parts of the body, such as the brain or muscles, get the oxygen they need to perform daily tasks.
Depending on your cardiovascular risk factors, your doctor might decide to include a strength training session in addition to whatever aerobic exercises you may be participating in now. In patients with diabetes, strength training in addition to aerobic exercise training has been shown to lower levels of hemoglobin A1C, which in turn lowers blood sugar levels. Know your cardiovascular risk factors and talk to your doctor before creating an exercise program on your own. Although aerobic exercise is very important to heart health, too much can cause temporary, even permanent damage. Frequent endurance aerobic activities such as marathons and triathlons can cause right ventricular dysfunction and in severe cases myocardial fibrosis. Make sure to not overwork yourself. Remember, your daily exercise can be a combined total of 30 minutes of moderate aerobic exercise.